Good evening. My name is Dusty Nichols and I'm the Director of Emergency Management for Shawnee County. I want to thank you for joining us here on Facebook Live with Dr. Pezzino and Mayor Michelle, who will be up here in just a moment. I want to just take a minute or two to discuss some of the critical infrastructure and a lot of questions we've had regarding businesses and employees having to have papers. If you received a paper from your employer, that is to indicate that you are an essential employee of that company. There is no need for Shawnee County to issue any papers to anyone for any business. So if you receive those papers, that is the company indicating that you are an essential employee. As we move forward to the next few days, it's going to be a little tough getting used to this. We know this order's been in place it's going to be in place for at least 30 days. So we want you as a business, if you're going to plan to be open, please go to the City of Topeka webpage, and at the bottom you're going to see an area for businesses to take a survey. Once you take that survey, it's going to open up a link, and we can then capture you as a critical infrastructure or an essential function. If you can't do that, please call. We have set up a phone bank. You can call 785-251-4848. That's 785-251-4848, or you can email covid19info@snco.us. Once you call or send that email to us, then we can help you decide how to progress further. So at this point, we'll introduce Dr. Pezzino and Mayor Michelle.
Good evening, Dr. Pezzino.
Good evening.
Thank you so much for your leadership. We
Thank
so
you.
appreciate having you watching over our community. You're like our angel, so thank you so much.
Thank you.
So thank you for requesting that we have a Facebook Live. Let's start with the questions that we're getting. Dr. Pezzino, why are we doing this?
Because we have to. When we first announced the order yesterday, I said, I went into a fairly lengthy explanation. I said, even though we don't have any cases in Shawnee County, all the signs point to the fact that we most likely have infection going on right now. That was yesterday. And we have cases all around the counties, and we cannot do testing very easily, so we really don't know how the disease is spreading. Situation today is different. Today we received not the first, not even the second, but the third confirmed case. So we have 3 cases reported to us all at once. We are still in the preliminary stage of investigation of these cases, so I cannot share too much information about their risk factors, but we know that 2 of them had the travel history out of state in neighboring states, and the third one so far we haven't been able to find any travel history, so we are still looking into that. But if that is confirmed, then that would appear to be our first community-based transmission for our county. So that's what we are doing. Based on the experience in other states, in other cities, in other countries, we know that this outbreak is going to spread at a very high speed, very high rate of speed. You probably heard about the exponential growth. The line goes like this, and then goes like this, and then it goes almost vertical. We are trying to avoid that. We are not going to stop the virus. We know it's already here. We can't stop it. What we can do is slowing it down, and that's what this ordinance tries to do.
Thank you so much. So as you can imagine, today we have been fielding a ton of questions with regards to what does this mean? What does safer at home allow me to do? So what are things that not just the things that I can't, but help us understand, what are the things that we can do during a safer at home?
There's still a lot that you can do. First of all, you can stay home safely, and that would be my top choice. Definitely, if you are in the high-risk group, so people older than 60 and people with underlying conditions, you absolutely should stay home. And hopefully you can have someone else take care of your grocery shopping and things like that. But if you are a healthy individual, you do not have any risk factors, you can still go out to take care of your immediate needs. You can go to the grocery store, you can go outside and exercise, as long as you do that alone or with a household member. So, for example, my wife and I, we still take our walks together around the neighborhood. You can go to a park and walk there on the park trail. You can go to doctor's office for medical visits. You can go to pharmacies to pick up the drugs. There is still a lot that you can do. However, we do encourage you to use that mobility with using some judgment. When I say you can go to the grocery store, it doesn't mean you should take 4 trips a day to the grocery store. Ideally, you would also go to a grocery store that's not 25 miles away, if possible. So always keep in mind the spirit of this ordinance. The goal and the spirit is we've got to stay away from each other. I know it's counter nature for most people. We just love to be social. We love to hug each other. We love to be in a social network. This is not the time to do it.
Thank you. The next question, I think Dusty answered, which is if they need to have paperwork to identify themselves as essential personnel. Dr. Pezzino, could you tell us what businesses are open?
The list is pretty long, and at least for now. So we try to start this ordinance balancing. We always do that. We always try to do that, but we are balancing the advantage and the benefit for the health of the public with the burden that we are imposing on the public. And we absolutely, fully, totally understand that there is a burden, that sometimes it's more than an inconvenience. It's just losing your job, losing your wages. So we try to be a little liberal, if you will, in the list of businesses that can remain open. Let's hope that works. I think it will if everybody cooperates. But right now, there is a very long list of businesses that are considered essential. And those are everything related to health and healthcare is considered essential. Things that are important for public safety, public works. Things that are important for food, so food production and, of course, grocery stores. Things that are important to maintain the safety in your home. So we allow janitorial and cleaning services to continue to do their business. However, I want to make a comment later on about what it means when those services are essential. It doesn't mean they can do business as usual, but they are considered as essential services. So the list is very long, and I don't want to just recite and then I would probably forget a few of them. I recommend that people go to the website and familiarize themselves with the list, but there is still a lot of services that you will not go hungry, your car will not run out of gas because the gas pump is closed, and you should not defer important medical care because of disorder. These are the 3 most important things. You're also allowed, as I said, to go out outdoors. It's right there. We are not going to shut down the outdoors. But again, do it either alone or with a family member, a household family member.
Thank you. I think it's so great for you to mention the fact that our grocery stores, our gas stations are still going to be open. And the other thing that is also open is childcare for essential personnel. Could you talk a little bit about that?
Absolutely. We are very sensitive to the childcare issue for several reasons. One is that I'm a parent of 3. My kids are all adults now, but it hasn't been that long ago that I still remember what the nightmare it was when there was a snow day, just one snow day, and we had to find, to struggle to find childcare for our kids. So we're very sensitive to that. But the other reason is because we know that the high proportion of people, especially women, involved in the healthcare system, they're also mothers or parents. And some of them are single parents. And the last thing I want to do is to lose precious healthcare workforce because these people cannot afford to go to work because they don't have childcare for their kids. So childcare places can remain open provided that, number one, only provide services to children of parents who are involved and engaged and working in essential positions. So they can't be open for everyone. They can only remain open for parents who are working essential jobs. And second, there are some additional precautions that they need to take in terms of the size of the group of children that they have and how they distribute those children in their premises that need to be put in place. And again, I'm not going to go into the details. They are very well described in our ordinance.
So we talked a little bit about what businesses are open. Could you tell us a few examples of what businesses are closed? What's closed?
Barbershops, nail saloons, exercise facilities that are indoors, so gyms. Most offices, unless they perform an essential service, most not-for-profit organizations are closed, except, of course, if their workers can work remotely. Besides being the county health officer, I work for the Kansas Health Institute, which is a non-profit organization in Topeka. Our office already closed at the beginning of this week, but we are all working. We are all working from home. So it doesn't mean when I say those places have to be closed, it doesn't mean that people are necessarily out of work, but they can't use their work site. Again, what is the goal of this ordinance? To avoid the people getting in contact with each other. So we don't want people to go to work and get in touch with each other and cluster around the water tower. We want to avoid that situation. Unless, of course, they are in essential occupations, and even then, they still need to maintain the 6 feet of distance, even when they're at work.
Thank you so much for that. So I think that we've addressed what you can't do, which is pretty much stay at home, don't leave the house. Don't
Unless
go
you have
work.
to.
Exactly, unless you have to. This is a really important question that we were asked. How do you know if you are a member of a vulnerable population? Do you need to report to work if you're a member of a vulnerable population and be part of an essential business? So like if you're an elderly or...
I think that there will be an arrangement between you and your employer. So obviously, if you're a member of an essential service, you are expected to go to work. But if you have underlying conditions that would put you in peril and in danger, if you do that, I highly recommend that you talk to your employer and you try to find out if there are maybe other arrangements that can be made to minimize your risk, the risk to you yourself as an employee. If maybe you can be reassigned to different tasks, or maybe if you need a leave of absence. That's something that we really cannot require or mandate. It's going to be on a case-by-case situation, case-by-case discussion with your employer.
So, Doctor, is the safer at home order mandatory?
Yes.
Thank you.
It is a mandatory. This is not an option. We are not suggesting, we are not recommending. Only very few times will you find in that ordinance the word recommend or encourage. Most of the time it's just people must do it. State laws allow the county health officer to take these measures when we need to protect the health of the public. It is the first time in a lifetime that any health officer in this country has to take measures like this. But when it's necessary, it's necessary. So yes, it is mandated, it is a requirement. And there are penalties for people who break that order.
What are the differences between shelter at home and social distancing?
I consider, and a little disclaimer here, if you look it up on the internet, you will probably find different definitions, and that's fine. Again, let's try to understand the concepts here primarily. I consider the stay safe at home a kind of subset of a social distancing strategy. So what social distance means is stay away from each other. It's that simple. Let's just stay away from each other. And the safer at home process is just one way to stay away from each other.
Okay. What do you do if you're sick and you need to go to the hospital?
It depends. If it is a life-threatening condition, like you have a chest pain, you think you're having a heart attack, you do the same as you would do, you call 911. Do not drive yourself there. First of all, if you are in a life-threatening situation, you should never drive yourself. And second, the people in 911, the ambulance crew that will come, and first responders, will know what to do to protect themselves from infection. If it's not a life-threatening situation, then you should call your healthcare provider or your hospital, the hospital where you intend to go, and they will give you directions on how to do that, whether you can drive yourself there and where exactly they will meet you, or whether you need an ambulance transport. What we are trying to discourage people from doing is just to show up in the emergency room. If you're sick, you really should not show up in the emergency room unless you think you have a life-threatening situation that cannot wait a single minute more.
Thank you. Can you still go to the dentist or the eye doctor for a routine checkup?
You can go to dentist and to the eye doctor for acute problems. You can certainly find a dentist that will see you for, if you have a root canal or a filling that has come loose. So things that require an immediate acute attention, yes. However, all the routine maintenance and health care should be postponed to better times. And most dentists, I think, have really closed their doors. But care is still available in our community. I just got a note the other day from a dental practice here in town with phone numbers saying, we are closed, but we are open for emergencies. Just call us and we will take care of you.
So Dr. Pezzino, I'm going to ask you for a question that will help me as a mom. So I want you to tell my daughters.
I love moms. Shoot.
Can you leave home to visit friends or family members if there is no need?
No.
Thank you so much for that.
Do I have to elaborate, or is that enough for you?
No,
Can you just say the doctor said no, and they would fly with your
No, I
daughters?
think that all parents are saying thank you for you right
Yeah.
now at this point in time.
But parents, please do take care of your children in
Absolutely.
that sense, and do parent your children in that way. It's just a wonderful way that our mayor is doing. They need to understand it's for their own protection as well as the protection of their dear ones. You really do not want your child to be responsible of transmitting his unrecognized infection to his friends who may have an underlying condition that your children don't even know, they're not even aware of, or to your own parents, so their grandparents. So really they need to stay home.
Can you go to the grocery store? Can you get prescription and other healthcare needs?
You can, only to the extent that that's to meet your immediate needs. So don't go to the grocery store to, stockpile on things for the next 3 months. Try to be reasonable. I think once or twice a week probably is reasonable for most people. One or two trips a week to a grocery store. You definitely can go and get your prescription filled. Anytime you are in public, and what public means is outside of your house, you are expected to maintain at least 6 feet of distance from anyone else around you. So that includes a grocery store, the drugstore, anywhere you go.
Can you still get items delivered to your home?
Absolutely, yes. And that's safe.
Will mail service continue?
Yes.
Are banks open?
Yes. Most of them will be open just for drive-through. If you need services that absolutely require a face-to-face meeting, then you may have to make arrangements with your bank. They are allowed to do that, but it may have to be by appointment. And again, the 6 feet distance still apply.
Can you take public transport?
Yes. 6 feet of distance still apply.
And not only that, but also for emergency and essential
Oh,
items.
absolutely.
things.
Absolutely. And the bus, I know, Mayor, you have had several conversations with our transit people, and they are fully intention to continue service. In fact, I heard that they waived their fees, so there is even no charge now for the tickets, so the public transportation was still available.
Are you still allowed to leave the house under the Safer at Home order?
Only for the reasons that are allowed in that order. You are not authorized to leave the house just because you want to have fun. You are not allowed to leave the house because you want to drive around. It's a beautiful today was a beautiful afternoon. I hope you took your drive today because you won't be able to do that tomorrow.
Which brings us to the next question. Can you travel outside of Shawnee County to go to work?
Only for the reasons specified and specifically allowed in the ordinance. So first of all, you should know that most counties around us, if not all, but certainly most of them, right now have similar ordinances in place as ours. So if you break our ordinance to go to different counties, chances are you're going to break 2 ordinances instead of 1. But if you are an employee in an essential line of business, then by all means you can do that. And that applies also to the reverse. If you live, let's say, in Douglas County and you work in an essential position here in Topeka, you can still travel to go to work.
How about if you have a fur baby, if you have a dog or a cat, a pet, can you go and get them supplies?
You can
take
go
them
and
to
get
the
them
vet?
supplies, and you can go and take them to the vet, again, for acute issues that need to be addressed. You probably will have to forego their haircut, just like you have to forego your own.
So this one is going to be a very challenging question, but I think that the public needs to understand why. Can you visit a family member in a nursing home or a hospital?
Short answer, unfortunately, no. For several reasons. They are signaling me here. Speak louder. And the reason I'm going down with my voice is because that's a very hard, you're right. This is a hard question. It's a hard answer to say. I'm going to say louder. No, you cannot. It's unfortunate, but you can't. First of all, I believe our hospitals have already severely restricted visitors to their inpatients for obvious reasons. You do not want anybody from outside to bring the infection inside, and you do not want any visitors to take an infection outside. Nursing homes are under directives from the federal government to ban all visitors. The only exceptions that are made are for compassionate reasons and end-of-life reason, essentially, where somebody is expected not to live for more than a few hours or a couple of days, then some limited visiting can be allowed.
I think that it's important that we make the exception. Does that apply when you have coronavirus?
The nursing home will have to, well, if you have a coronavirus, you're infectious, probably you're going to be in a hospital, in an ICU. So that will be up to the hospital to decide that. Chances are you would be able to say goodbye just through a window, through glass, and not by holding hands or anything like that. My comment was referring to people who may be in a nursing home and close to dying for other unrelated reasons. There will be some limited compassionate use of that exception for end-of-life situations, but it will be on a very limited base, just a very close and strictly closed family members, and it's not going to be like all the friends can come and say goodbye to the poor person. It's heartbreaking. I can't even imagine what it is like for somebody having to die in solitude, and for his friends and relatives to watch this person die without being able to be there. But it's an unfortunately side effect, if you will, that we need to absorb.
So since we're talking about end of life, how does clergy apply to end of life and funerals?
Funerals are allowed on a limited basis, and so are weddings. And again, the ordinance includes more details. Same thing for clergy. If that applies to an end-of-life situation, it will be up to the either nursing home or facility where the person is living at that time to decide what is the safest way through which we can accommodate the need while also not putting in danger the health of the other residents and the staff in the facility.
Can you go to church?
You can go to church virtually. And I still consider it church, personally. It's not just church, all places of worshiping. Mm-hmm. The reason we are not allowing people to visit their place of worship is because typically that's where people like to congregate and socialize. It's one great thing to do. I fully understand that. Think about also the fact that in many cases, church attendees have a disproportionately high representation of people over 60s or people who are sick and people for whom sometimes church is the only reason to go out during the week because they're too sick to do anything else. So again, it's heartbreaking, but it's first of all for their own protection. They really can't do that. What we have decided to allow is to have up to 3 people from their place of worship. Let's use the term church for simplicity, but I want to be clear, it doesn't apply just to church. It's applied to mosques, to synagogues, every place of worship.
Hindu temple? Mm-hmm.
Temples, yes. Up to 3 people can be inside the premise if it's necessary to broadcast the service. They still need to maintain the 6 feet of distance, and everyone else will have to enjoy the service at the distance through whatever web connection they have available.
Or the phone, for the people
Or
that
the
don't
phone.
have access to the web.
Absolutely.
Can you exercise?
You can exercise. You should exercise. The outdoors is open. That's not going to close. Of course, there are limitations. You cannot go to the gym. You cannot not exercise in groups. You can only exercise alone or with a household family member, somebody who lives with you. You can definitely go out and walk, you can go out and run, you can ride your bicycle, but again, not in groups, just as a single person. And I highly encourage you to take advantage of that. It's going to be a long 4 weeks. And I have to tell you, I've been working from home this week because, as I say, my office closed. And I've been working very long hours, like all of us in this room, and probably many of our viewers as well. And nothing was more refreshing than forcing myself to take a break at 5:30 or 6 o'clock in the evening and walk around my beautiful neighborhood and look at the beginning of the sunset and just, the 15-20 minutes of rejuvenating myself. I highly recommend you do that. You've got to stay active. You've got to be healthy, and that's something that you can do.
How do you know if you are an essential employee or work for an essential business?
Business will know. And if they don't know, there is a survey that has been mentioned earlier in the program that they can take on the City of Topeka website. And the Department of Emergency Management will help them determine whether they are essential businesses or not. It's not up to you to call anybody, to call the county, to call the state, to decide whether you are an essential employee or not. I want to clarify something. Just because a business is deemed an essential business, it doesn't mean that everything that the business does is essential. That's the first thing I want to clarify. So, there is essential businesses and then there are essential functions. Only the essential functions can be carried out under this ordinance, and they will be carried out by essential business by definition. But sometimes essential business carry out also additional functions that are not essential. In that case, those functions should not be continued. So even just because you are an employee of a company, let's say a hospital, or probably the hospital is not the best example, maybe a grocery store, or an outside a dental clinic. Let's take dental clinic. Just because you work for a dental clinic, it doesn't make you automatically an essential employee. It depends what your function is in that dental clinic. And same thing applies to all the different businesses. That's the first thing I want to clarify. The other thing is, when we say essential, we don't mean that everybody who's non-essential is not useful. I really want to be clear on that, because I remember my days when I was working at the state, and there was a conversation, when we have furloughs and only essential people can be. What do you mean I'm not essential? Look at the kind of work. Well, yeah, but essential means really mission critical to meet acute needs. It doesn't mean that you are non-important. So if you're not considered an essential employee, don't feel that you're not valued.
Absolutely.
Your time at home will be essential for the rest of us to do our job at work.
So we only have 2 more questions before we go out to the public questions. I love this one. People are trying to get out of this. Can you still mow the lawn?
You can mow the lawn, and that's also good exercise. And you can also continue to hire your landscape maintenance people or company to do that. However, what you cannot do is doing major projects, landscaping projects. So again, if you have somebody who comes regularly to mow your lawn and trim your bushes, that's fine. That's regular maintenance, and that's okay. But if you want to start, 2 new flower beds here and plant more grass over there, and that's not an acute need, so that should be postponed.
Okay. Can construction projects start or continue?
Similar to what I just said, you should not start any major remodeling at this time. You should postpone it unless it's something that you need to do for sanitation or safety in your house. This is not the time to start your $30,000 kitchen remodeling project. But if you have a project that's already started, even if it is a big kitchen remodeling project and it's halfway now, you definitely can and should finish it, because otherwise your house will be in an unsafe condition. And other maintenance, if your toilet is stuck and you need a plumber, by all means you can call a plumber and they will come and fix it. So again, the distinction is between the acute needs that can't really wait, and those are the things that can wait.
So here we have the questions from people that are watching right now. Can I go fishing or bird watching?
Yes, you can. But again, you can do that alone or with a household family member, somebody who lives with you. and you always need to stay at least 6 feet from anyone else around you. What I do not want to see, I'm going to be really clear here. I love things like our Shawnee Lake path and Gage Park. I mean, we are really lucky in Topeka. We have beautiful, wonderful facilities outdoors. I do not want to see big crowds on those places on a beautiful Sunday afternoon. We have seen some horrible pictures coming out of other states. If that happens, people really are not doing a good job understanding. We are not doing a good job explaining to people why we are doing what we are doing, or people are not listening, and they need to listen. 6 feet from everyone else.
So if I'm moving from my house to a new house that I had already purchased before this all happened, can my family come and help me move?
I would say probably not. If you want to hire a moving company, you can do that. Those are professionals. They are considered an essential service. So a moving company is considered an essential service. As such, you will be trained on how to keep their precautions in place. You will maintain a 6 feet of distance from them. But again, having friends help you move, I would say that's probably not good use of this ordinance.
So another question that we just had was about custody exchanges. How do we manage custody exchanges throughout the Safer of Home ordinance?
I would say that the exchange will have to take place either, just in the front door or just outside. So you should avoid to meet in a public place, for example. Of course, coffee shops are primarily closed now, but I wouldn't recommend you say, hey, let's meet at the corner between Burlingame and 29. Then no, that's enough. So either at one of the parents' house or just outside of the house, and then keep, if you are not living with the other parent of your child, still keep a 6 foot of distance. And when your child comes back, make sure that the child does some good hygiene procedures, washing hands and maybe taking a good shower, taking a bath and changing clothes. So you minimize your exposure as a parent to whatever the child was exposed to.
That's a great answer. How about churches? Can a few people meet together to provide a live stream? I know that you already answered this, that it was 3, but could you talk a little bit about that again? Because apparently people missed it.
At this point, we are not allowing more than 3 people in a church or a religious institution, and only for the purpose of delivering a web-based service. Anyone else who is participating in the service remotely, you have to do it from your house. You cannot get together with other.
So here's another really good question. If I've already had COVID, am I immune to getting it again? Is there any research on that?
There is COVID is what we call a novel virus, which means it's never been around infecting humans before. So we are learning as we are going. The best available evidence that we have, also based on experience with similar viruses before, is that there should be immunity at least for some time. We still don't know if this virus is going to behave like the influenza virus. So it's going to mutate from season to season, and then next season the immunity from the previous season may just be partial. But for now, for practical purposes, if you are cured and you are told by your healthcare provider that you no longer need to be on isolation, you should be immune.
Okay. So what if you work in Douglas County or in any other county and you are essential there? Can you go to work?
Yes.
Okay.
Yes.
Can kids...
But again, you just go to work there. Mm-hmm. You don't take the side road and you don't stop and see a friend because now you are allowed to go out so you can do a bunch of things that you think other people can't.
I know that at one point in time there were people doing, and you've seen videos on Facebook of during other communities, safer at home type ordinances that are driving around and waving at the houses. Is that allowed for somebody to?
If it's just a leisurely drive, no. I mean, if you are out and about for a legitimate reason, like you're going to a grocery store, you're going to work in an essential service, then sure, you can be friendly, keep your windows up, please don't come close to people. Mm-hmm. But otherwise, no leisure driving. And the reason, again, we just want to minimize the amount of people who are out and about. I understand you are alone in your car. You are not posing a risk to anybody. But reality is you are alone in your car and then you're running out of gas. So you stop at the gas station, which probably you would not have done if you stayed home without going for your leisure trip. Before you know, you find a friend at the gas station, and then you say, "Oh, hey, how's it going? How is this? Are you staying home?" And then you come closer to the person. It just increases the amount of people who are outside of the house and shouldn't be. So that's why I do fully understand that people who would be just alone in their car are not a danger to anybody. But in reality, if everybody starts going out just for pleasure, we are going to have traffic around. People are not going to work, many people. So the beautiful days like today, a lot of people will be out and about. There is an increased likelihood of car accidents, car crashes. So then our first responders can come and have to come. So it's just not a good idea.
So people are asking, can kids go to the playground? And if they can go, can they play in groups? And if kids are out, how many kids could be together?
No, and no. No playgrounds. Playgrounds are, so I said earlier, you can go and use the outdoors facilities. You can use the park and rec facilities, except for playgrounds, because they're not sanitized. They would be very hard to sanitize. And there is a lot of contact between the child and the structure there, and you just don't know who was using the structure half an hour earlier. This is going to be one of the hardest things, to keep your kids separated from their friends, especially young kids. Again, it hasn't been that long since I was in that position. I fully recognize that. It's for their own good and for your own good. You do not want your kid to have a very sick parent or, heaven forbid, to lose one of the parents because you had a birthday party in the house with some of his friends who were unknowingly infected.
Can you deliver food to an elderly member of the family or to elderly friends?
If it's somebody who cannot provide for their own needs, then yes, you can do that. 6 feet of distance. Did I say that already? 6 feet of distance? Yeah,
I think
6
we did.
feet of distance, once
I don't
or
know.
twice.
I think we have a little bit more than 6. So
I hope
yes.
so.
So if I'm immunocompromised, but I'm an essential employee, allowed to go to work, should they force me to go to work if I have way to prove that I'm immunocompromised?
That is an area where the health officer, I don't think, has a lot of teeth to use, if you will. I suppose there may be other venues, other legal venues that people in that position can take if they are, forced to go to work in a situation that's unhealthy for them. I wish I had a better answer. I think ethically, if you ask me ethically, I think it's wrong. I don't think an employer should force somebody in a high-risk group to go to work, even if it is an essential position. I would hope that in most cases people will use some common sense and sense of solidarity and find another arrangement for that person temporarily be reassigned to a job that doesn't put them at risk.
So if I'm moving to Kansas from another state, can I still move to Kansas?
Roads are open, the highway is open, yes, you can still move to Kansas.
But what happens if I come from one of the tier 3 states that are already the states that we're supposed to
You may be
register?
subject to a quarantine order depending on where you're coming from. And that's also if you're a Kansan. So anyone returning from, at this point I believe it's California, Washington State, New York, Florida, and a few counties in Colorado will have to be subject to a 14-day quarantine at home, as well as anybody coming from an outside country, from different countries from the United States.
So what about if somebody is going to go to a person's house for some loan documents? If they're a real estate agent or a bank or somebody that's dealing
Right.
with that loan.
So at this point, real estate services are considered as essential services, with the caveat that I indicated before. And actually, I think if I remember right, there is in the ordinance specific language that applies to administrative and professional services, including real estate. So only transactions that cannot be postponed should take place, and only transactions that cannot be done remotely, it should be done face to face. Somebody has to sign documents physically, then meeting may be necessary. I would recommend that 6 feet of distance takes place. You can slide the document across the table and then make sure that you clean the table and disinfect. But honestly, people can sell a house from the other side of the globe these days with electronic signatures. And so again, I hope that our real estate agents and everybody working in that industry understands that the spirit of this ordinance is to keep people away from each other. So we do not want to stop real estate business by all means. That's a very important business. I do not want to force people not to sell their house. They need to sell their house. But at the same time, I hope that they do it in a very judicious way, in a way that can be safe for everybody. May not be necessary to have face-to-face meetings to sell a house.
So the last question that we're getting is a very emotional question, in the sense that we have a person that is telling us that they are having some challenges with their mental health. And we've talked often about how this is a very difficult time for all of us. I think that everybody in our community is trying to figure out, even if you don't have issues like depression or anxiety, for anybody, having to adjust to a new normal can cause emotional stress and trauma. This person is saying that being alone is really hard for them. What are some words of wisdom that we can give them?
Well, first of all, I sympathize with that. I totally get it. I'm lucky enough that I'm not in this situation now, but I do know people who are in this situation, and I worry about them. Hopefully, there are other ways that people can keep some social connections besides that being physically together. And even though they're never going to be the same as giving each other a hug, they are still nevertheless very important. So I encourage people in that situation to make the best use of FaceTime and Zoom conferencing and whatever means they have to stay in touch with their friends and relatives. It may sound like a very minor detail, but the difference between a phone call and a video call is huge. Being able to see each other, even though just on a screen, is huge difference. So that's the first thing. The second thing, if you really feel like you are in need to mental health care, that is definitely an essential need, essential service, and you should not put that off. You should call your healthcare provider or behavioral health provider and have a conversation with them, or the suicide hotline 24/7, and they can help you with that. If you are in acute crisis, don't put that off. Just by all means seek help. Otherwise, hang in there. We feel your pain. Try to mitigate that distance using those tools that I said, and this is not going to last forever, I promise.
I know, and I think that it's a great time to remind people. During these times, we sometimes see the best in us come out. And I think that last question was so important, because I think that it's a reflection on the fact that all of us are having a challenge right now, and it's almost like a call to action for us to take care of each other, for us to pick up the phone and FaceTime our family members,
Yes.
and pick up the phone and call the people that may not have the video chat, but making sure that you could do so. I think that these are times that call for the best of each other. And I know that our community, Shawnee County and the city of Topeka, have some amazing citizens that are going to rise to the occasion. And because of your great leadership, Dr. Pezzino, and the leadership of
And yours.
and emergency management and our partners that have been working together, I know that we have made some really difficult decisions that are going to hopefully help us get over this bad situation in a much safer fashion, so that we can very soon hug each other again.
We will go back to life as normal, I promise. At some point we will.
Okay.
Thank you.
Thank you, guys.